How's it going? Oh, I can't hear you.
First time, you can go ahead and pause that recording for right now. We don't
Okay.
need to.
And I'm gonna mute myself.
So Jace, I'll just mention you'll take anything in the chat or questions and just thank you. I appreciate that. So welcome. I think we're going to go ahead and get started. I'm Liz Hodgkins. I'm the Director of Adult Programs here at NAMI, New Hampshire. And we are so glad that you are joining us for this session today. So Heather Martin came to us a little while back, just wanting to be able to share her information, her passion, her expertise with our community. And as today is World Maternal Mental Health Day, it seemed really appropriate for us to plan the session for today. So we really appreciate Heather just sharing what she knows here with us today. This is part of our Mental Health Awareness Month offering. So please take a look at our website for more information about other options that are available. So just to do a quick little introduction of Heather, after the tragic loss of her sister to suicide, Heather was driven to bring awareness and support to the importance of postpartum mental health care. As a medical assistant at the Dartmouth Health Pediatrics, Heather was in contact with many new parents and saw the need to offer support and screening is at her practice. So Heather began her learning journey implementing screening and follow-up connection for mothers. She was named the 2020 Mom Ambassador of the Year in 2021, is one of 4 postpartum support coordinators for the state of New Hampshire, and was recently certified in an evidence-based mothers and babies, providing intervention and support for pregnant people and new parents. So we welcome Heather, and I will let her take it from here. Thank you, Heather.
Hi, everyone, and thank you for joining me on your lunchtime for a super exciting day. It's Maternal Mental Health Day, and in our maternal mental health community, it's a day that we can yell from the rooftops even more than we already do about maternal mental health and the importance of maternal mental health. So I thank you for joining me on this day. So next slide, please, Jace. I am a medical assistant at Dartmouth Health Pediatrics in Manchester. I've been here about 10 years. I, like Liz said, I became a 2020 Mom Ambassador of the Year last year for spreading awareness on social media, also here in the medical community, here across the state, recognizing the need and support for our moms. I more recently became a postpartum international support coordinator here in New Hampshire. The moms call a helpline either through text, through email, and they can get in touch with one of the 4 postpartum international support coordinators to get mental health help. So I've been doing that, and very rewarding. Talk to moms every day, struggling, dads struggling. So very important position, and I'm very happy to be part of Postpartum International. Next slide, please. Why maternal mental health matters to me. What's my story? Why am I so passionate about it? This is a picture of my beautiful sister that I lost 13 years ago to what we believe now was postpartum psychosis. She gave birth to my beautiful niece 13 years ago, and within 1 to 2 weeks postpartum, she became withdrawn, just not herself, a look that I will never forget on her face, just a look of lost, not herself, a look that I never want to see on another mom's face again. And ultimately, she died by suicide about 3 weeks after giving birth to my beautiful niece. So this has been a journey for me for the past 13 years, trying to understand why, what happened, what we could have done better, not only here in our state, but across all over the world, what things that we can do better to help our moms so that this never happens to another mom again. Next slide, please. What is maternal mental health? There's many different things on the spectrum of maternal mental health. More commonly, we talk about postpartum depression, anxiety, OCD. Something I didn't list here, what we think my sister suffered from was postpartum psychosis, very rare, perinatal mood disorder, but it does happen. And symptoms can occur during pregnancy and up to the first year postpartum, and sometimes longer. Patients report feeling signs up to 3 years postpartum. So it definitely, and it does not discriminate. Parents of every culture, age, income, it doesn't discriminate. My sister had a healthy pregnancy, healthy childbirth. We did not expect anything like this to happen. Very happy, outgoing, beautiful woman that we never expected that to happen. So it does not discriminate. It can happen to anybody. Next slide, please. Generalized symptoms of a perinatal mood disorder. This is the first one, is something that I see all the time in the pediatric practice, persistent worry of the baby's health, baby's having trouble breathing, baby's heart rate is not right, baby's having trouble feeding, it's fussy, just persistent worry about the baby's well-being, obsessive or compulsive behaviors, abrupt mood swings, just abnormal mood swings. Yes, they can feel sad, low, and crying for no obvious reason, but it's persistent. Big one, having little or no interest in all the normal things that bring joy. This is one of the questions that we have in our screeners that we use here in pediatrics and during the OB visits. This is a huge question that we often ask mothers. Are you having little or no interest in all the normal things that you're used to doing? Withdrawing from friends and family, big one. Lack of sleep, that was a big factor in the outcome of my sister. She did not sleep. Lack of sleep is a huge symptom. Next slide, please. Risk factors include a history of a mood disorder, substance abuse. There's many different risk factors. Maternal depression with a previous pregnancy, life stress, unplanned or unwanted pregnancy. Single mothers is a huge risk factor. And one of the bigger ones that I talk to moms a lot is a lack of social support or lack of community support. Not having the friends and family around that are needed to help support our mothers and babies postpartum. Next slide, please. It's more common than you think. The numbers that I'm going to show you, it's probably more prevalent. Those are only reported numbers. There's a huge stigma around postpartum issues, maternal mental health issues. They're going to think I'm crazy. They're not going to believe me. And, all these feelings, we tell moms these are all normal feelings to have. If we can just break the stigma of these feelings that these moms are having. Next slide. Quick facts from my friends at 2020 Mom. Up to 1 in 5 women will suffer from a maternal mental health disorder like postpartum depression, compared to 1 in 7 pre-pandemic. That is a huge change. The pandemic definitely changed, the maternal mental health community. Is definitely worsened it for our mothers. This next number, less than 15% of women will receive treatment. That is a low number. We need to make that number higher. We need to make it okay for mothers to speak out, to ask for help, to ask their families for help and friends. Medical community needs to be more involved with our mothers, and we'll talk more about that. And more than 600,000 women in our country will suffer from a maternal mental health disorder every year in our country. Next slide, please. And things we can do to prevent this. This is huge. Prevention is huge. In the medical community, postpartum screenings. I'm a huge advocate for screenings. Yes, you can do the screenings postpartum, but you also have to have the tools and the resources available to help these mothers if they screen positive. The screenings are no good unless you have the tools and the resources to back up our mothers once they screen positive. As far as community, spouses, family, and friends, the simplest thing, check on mom. It sounds like a simple thing, but just the saying of "how are you, mom?" it can make a world of difference for these mothers, just asking how they are. Huge advocate for having a postpartum plan. During pregnancy, we go to the OBGYN many times, many visits. We go for a lot more visits than we do postpartum. Postpartum, it's about 6 to 8 weeks for the mother to go for their follow-up. That's not soon enough. We need to have a plan, the 4th trimester, we call it, especially with high-risk moms that we know have a history of a mood disorder, poor support system, social stressors, and financial stress. Next slide, please. Screening, that I'm a big advocate for screening. Successful screening during the pediatric visits. We started this about a year, a little less than a year before the pandemic here at Dartmouth Health in Manchester. And then COVID happened and our mothers are really struggling. So doing screening for up to 1 year in the pediatric practice is already recommended by the American Academy of Pediatrics. So, and it makes sense for us to do the screenings at the pediatric practice. That's where we see our moms and our families more often. So why wouldn't we be doing screening and talking about maternal mental health, because it affects the baby's mental health. And we see them more at the pediatric practice. So it only makes sense. And we can fill the gap until they see the OBGYN. Opens up the conversation during those pediatric visits as far as the mom's mental health, the family well-being. The biggest thing that I can say as far as the screening is the follow-up piece is the most important. After they screen positive, we need to do a follow-up. You need to check up on them in about a week or two after they screen positive. We give them a mental health resource list if needed. If they don't already have a mental health resource, we have a dedicated list. It's updated. I make it a project of mine to update it constantly, making sure that these mental health providers are taking new patients. That's a big roadblock for us, as they need to be available for these mothers when they call. So we give them a designated resource list. Next slide, please. The screening tools that we use more commonly with postpartum or during pregnancy, the NBERG, that's the one that we use in the pediatric practice. It's a simple 10 questions. It's more commonly used during the perinatal period. It's been proven to work. It addresses anxiety. Also PHQ-9, PHQ-2, the GAD, sleep screens are also used. You can click on the link. 2020 Mom has some more information about the screening tools, but the NBERG, that's really the one that is more commonly used because it's meant for the perinatal period. Next screen, please. Evidence-based treatment options. It can be one or a combination of things. More commonly, psychotherapy, such as CBT. I've been learning a lot about that lately. The Mothers and Babies program that I just recently trained about uses a lot of this. Medication, moms are sometimes hesitant about the medication as far as breastfeeding and will it get to my baby? Will it harm my baby? There are safe options for mothers that are breastfeeding, and we reiterate that. And it's, a lot of the times it's not always that you have to take medication forever. It is just temporary for some of these moms. So a lot of moms are hesitant. We tell them those things. Meditation seems like a simple thing, and a lot of moms are hesitant about this because they say, how am I going to find 20 minutes to a half an hour to meditate? But it's going back to recognizing support systems. Hey, can you come watch my baby for a couple hours so I can go use a sound machine, meditate to myself? That's definitely a good option for some of our moms, just taking that time to do so. Different supplements help with moms, yoga and exercise. A big thing that I tell my moms all the time is taking 10 minutes just to get outside and go for a walk. Sometimes just that 10 minutes a day, getting up, getting out of the house. Sometimes you really have to push the moms to do so. But once they get out and do that, it makes a world of difference for these moms. And improved sleep, same thing, sound machine, somebody to help support the baby. These moms need to get their sleep, even just for a couple hours at a time. It does help for moms to get some sleep. Some emerging things, we talk about TMS. I know here at NAMI, they've been talking about this a lot, ECT, and then there's also an infusion therapy that's in the works. It's about a couple of years old, but is not available as far as I know in New Hampshire right now. But still working on these things. We need to do more. We need to have more options for our mothers, especially here in New Hampshire. Hoping to advocate more for that. Next slide, please. And we're learning more about the impact on our children for untreated maternal depression. Unfortunately, it can cause some issues for our children for untreated maternal depression. Emotional and social problems. They've done a lot of research. It's been proven kids can have lower self-esteem, increased anxiety, increased risk for depression, problems securing relationships, can also cause developmental delays in infants and children, late walking and talking, and delayed readiness for school, learning difficulties, attention deficit, focus impairment. So unfortunately, it can have some negative impacts on children. Next slide, please. What we can do as a society to help our moms, it's not just here in the medical community. There's simple things that we can do to help our moms just in the community as in general. We need to normalize maternal mental health disorders. We need to, if you yourself, of somebody that has struggled during pregnancy or during postpartum, we need to help spread awareness. Share your stories with someone that that's struggling. Sometimes just sharing your story, oh, I've been through that, and you will make it through, makes a world of difference for these moms, to make them feel that they're not alone. A big thing we tell moms is, you are not the symptom. This is the way that you're feeling is just temporary. And at Postpartum International, we always say to our moms, with help, you will be well. And sometimes just saying those words to mothers can make them turn around a little bit, just by hearing, with help, you will be well. You won't feel this way forever, and we will get you help, and you will be well. I'll say it again, check on mom, not just the baby. How are you feeling, mom? Have you been sleeping? Are you eating okay? That is a huge thing that we can do for our mothers. It's not just about the baby. The baby's well-being depends on our mother's health, not only physically, but mentally. A big thing especially here in our country, we lack paid maternity leave and longer maternity leaves. We do not get enough time to bond with our babies, and with financial stress, we have to get back to work. Then moms are worried about childcare. Their babies are going to daycare. I'm worried my baby's going to get sick at daycare. We need to, in this country, advocate for longer maternity leaves and paid maternity leaves. That would make a world of difference for our moms' mental health here in this country. And not just the moms, our families. Education for our families, know what to look for, know who to contact if we know that a mom is struggling. You know your wife is struggling. Who do I talk to? You know, a lot of times I'll get calls from dads. It's really endearing. They're really worried about their wives and their well-being. And we get their wives help. We find them mental health help, and we help their wives. So that's really a good sign that dads are more aware of this issue by spreading awareness. Our families recognize it more and more as we go through these years. We recognize that this is an issue. The more people advocate, this issue will get better over time. Next slide, please. Can you go to the next slide, Jace? Thank you. So some big resources, definitely that you can rely on. Postpartum.net is a huge, it's Postpartum International, huge organization that's amazing, that has some groups on there. You can contact anyone from any state to get a mental health resource. They are a great resource. So if you're in the medical community, or you're just, a family friend, you can get support from this website. Also 2020 Mom is a good one. NAMI New Hampshire, of course, and Suicide Prevention Lifeline is there for you too. I left my information too. If anybody, I'm always happy to answer questions. And if I don't know the answer, I will find out for you. As far as resource help or things that we can do, my email address is there for you too. But I want to thank everybody for joining me and on this World Maternal Mental Health Day. I'm happy you shared your lunchtime with me, and if anybody has any questions, I'd be happy to answer them.
Hi, Heather. There are a few questions that did come in, and I will pose them to you. But first, I'll get a couple of the things, the first questions out of the way, which, yes, the session is recorded, and we will send it out we'll post it on our YouTube page, but we'll also share it with anybody who was registered, as sometimes people register for sessions and miss part of it or would like to share it with someone else. So once that is available, we will send it out to folks. So I think let's start with some questions here. Oopsie. Okay. So the first question is, would you be able to share the list of providers that are accepting new patients, or what is the best way to get that list?
The best way here to get that mental health resource list would be to contact that website, postpartum.net. And then they used to have our numbers visible to anyone, but now they're kind of honing in on what areas that we cover and what areas we're more familiar with the resources. So they don't have our numbers visible anymore, or our email addresses. So the best way would be to do a contact through postpartum.net. And then you're able to click on our state, and they're able to almost like assign it to one of the support coordinators, and we can get them. But as far as me personally, you can reach out to that email address, and I can try and get you connected with PSI trained people if it's someone from the medical community looking for mental health resource that's PSI trained. Like, I can connect you that way.
Okay. Our Dartmouth Hitchcock pediatrician, so this might be a question that you may or may not be able to provide an answer to. Are Dartmouth Hitchcock pediatricians in Nashua and Concord using the Edinburgh screening as well?
So Nashua is, they rolled it out. I'm not sure when they rolled it out, but we rolled it out around 3 years ago, and they were probably a couple years after that. But I don't know if Concord is doing it right now. I'm on a mission to have it done everywhere, not just at Dartmouth Health, but at every pediatrician's office. So I'm on a mission, and I will help get this on board for everybody, because it is recommended by the AAP. And the more people know about it, the more providers are comfortable with it. That was a big obstacle at first, is the pediatricians being comfortable with what do we do when a mom screens positive. But we have honed in on a workflow, definitely with the follow-up calls in 1 to 2 weeks. I'm doing the mothers and babies intervention, sometimes for our mothers that need immediate assistance. So, the hesitancy is there with our pediatricians, but not anymore. Once we started getting going on it, they could not picture us not doing it, because we have helped so many mothers, especially during this pandemic. So I continue to spread the word, want it to be done everywhere. I know it is done in Lebanon. I know that they do the screening up in Lebanon, but it's a little different than how we do it down here, but I'm working on it.
So this is a little bit outside of our geographic region, Heather, but this person lives in Cameroon, Central Africa. But I think the question is still one that is still good, because I know you started at this spot too, where to start in an environment like hers or theirs, where postpartum depression and mental health issues are not well addressed in the community or the country. So what do you have recommendations?
Where to start with the screening and just spreading advocacy by talking about the issue. That's been the biggest thing that we can do, is just sharing our stories, our families, our communities. I know that people came out of the woodwork when I started sharing my story, and a lot of people did know my sister's story that were close to me. But once I started spreading it on social media, the amount of response that I received was mind-blowing. Like, everybody had a story. Oh, I felt this way. I know someone that felt this way. You have helped me recognize the signs and symptoms, and I went to get help. So just spreading awareness just on a local level can make a world of difference. And I'm trying to take it one step further in the medical community to just continue the conversation, because just by opening the conversation and knowing the signs and symptoms and what to do, who to ask for help, has brought this issue to the forefront, especially with the pandemic. We definitely can do simple things to help our moms during this pandemic, just by recognizing the issue. I hope that answers it a little bit.
Yeah, I think you did a great job with that. So the next question is, would you recommend scheduling screening with your provider before you give birth, so that you know it's scheduled and it's not a stressor post-birth?
I think as far as I know, the OBGYN, when you do your visits before, I think they do a screener before. But I mean, if you have a mental health disorder already, or you're at risk for a mental health disorder, I talk to your provider, and they definitely be on the lookout. I know for myself personally, given my sister's history, it didn't automatically make me at risk, but I knew the signs and symptoms, and I talked to my provider about it, because I was nervous for myself. Because you can have a family history of a mental health disorder. So I was aware of the signs and the symptoms, but I would open up the conversation with your provider if that's something that you're worried about, and they can do the screening for you. And they definitely, I'm almost positive they do it at the OBGYN during pregnancy. They should be. And then they definitely do it after you give birth in the hospital. I do know that for sure.
So it looks like we've come to the end of our questions, Heather. I just will let folks know that after the session, there will be a short evaluation. We appreciate you taking the time to provide us with some feedback. Thank you, Heather, for taking the time to share this very important topic with our community on World Mental Health Day. And we appreciate your time and dedication to this topic. And, you know, as I mentioned to you earlier today, and just sharing your information as part of the grassroots mission of NAMI New Hampshire. So we really appreciate that you took the time to share that here with us today. So thank you all for joining us. And as mentioned, this session will be recorded and we'll send it out to you. Please go ahead and share with anyone if you think that they would be interested. We will also send along a PDF of the slides so that you can access any of those resource links that were available. So thank you, Heather, and thank you all. Take care.
Thank you, everyone. Have a good day.